Hi, I'm Joe Feeks, editor of Pig Health Today, and with me is Dr. Marie Culhane. She is an associate professor at the University of Minnesota. Great to see you, Marie.
Thank you.
We're going to talk about swine influenza, which is always a moving target, it seems. Obviously, biosecurity would play a big role in managing that, or any disease, but I know vaccination does too. And the industry currently has autogenous vaccines. They have the killed commercial vaccine or inactivated vaccine, and more recently, a live vaccine. You've been looking at some programs where you're taking a more integrated approach and using some of these in the same program.
Yeah, what we've discovered at the University of Minnesota is that you have to take a multi-step approach to controlling influenza. And so relying solely on vaccine will probably not get you the results that you want. You have to try vaccine strategies with different management strategies to really control the disease. Management strategies are hard to control because there's a lot of people involved. So we kind of focus a lot on those different vaccine strategies. And that was the goal of this study. What new vaccine strategies could we try in an experimental setting to see which way we want to go into the field setting? So this was a very preliminary pilot study of trying different vaccine combinations and seeing what the results were.
And has it always been using one vaccine or the other, or is this the first time that you've tried using them together?
This was the first time that we've tried using different vaccines in different combinations, and that's a process called prime boost. And because it was a different vaccine combination, it's called heterologous prime boost. Heterologous means different.
And when you say prime boost, specifically, what do you mean by that?
Yep, so usually influenza vaccines, because they're killed vaccines, require a prime or a first dose, and then a second or a boost dose. And really the effects of the vaccination are seen after that second dose or boost dose. And so when we're splitting up the vaccines, giving one vaccine as a prime and a different vaccine as a boost, that's a new concept that's only been recently tried in the last few years and by different researchers. Because typically what's done on a farm is you give the same vaccine for the prime and the same vaccine for the boost. And because it's a killed product, you need to give two.
And we're talking grower pigs now?
These results were done in growing pigs, pigs post-weaning. But the same concepts, whether you were vaccinating sows or replacement gilts, would be the same, that you would give one dose as a prime and the second dose as a boost.
And so typically, when does the first dose come and when would you follow up with the second dose?
You want to get both doses of vaccine in 2 to 4 weeks before you expect to see the clinical signs. And so that's kind of always a guessing game. But based on production data, you can say, for example, all my pigs always cough around 16 weeks of age, and it's probably influenza due to monitoring, and so I want to get both vaccinations in when my pigs, prior to them becoming 12 or 13 weeks of age in the growing pigs. Vaccinating growing pigs is very expensive, so a lot of people focus that vaccination on the sows. And then when you vaccinate the sows, your hope is that that sow will have immunity that she'll pass on through her colostrum through the pigs in the form of maternal antibodies. And so a lot of the research and a lot of the vaccination is given to sows. Very little is given to the growing pigs. However, when we're testing new vaccine combinations or effects and results of vaccine to challenge, we usually do it in the growing pig. It's just easier in the experimental model to have that 30-pound pig rather than that 300-pound sow.
So it's great to use all the available tools that are in the toolbox, but was there something that motivated you or inspired you even to try to use these different types of vaccines in the same program?
And so we feel rather confident though those vaccines will do what they say. They'll induce an immune response to the vaccine viruses. However, influenza, like you introduced, changes quite a bit.
Yeah.
And so it's hard to get that thoroughly licensed, completely tested vaccine up to date today to put into the farm tomorrow. That just doesn't happen. But we still think that those commercially available vaccines have their place. And so what veterinarians in the United States have done is they know that there's certain strains in their herd that are different than the strains that are in the vaccine. And so they go down this path called autogenous vaccines, and those are killed vaccines there as well. And what it is you take the virus that's infecting your herd and you get that virus isolated, send it to the vaccine company, and that vaccine should be more closely related to the vaccine in your herd. In fact, it just came out of your herd, so hopefully it hasn't changed very much. And so we thought, well, that's a very common practice. We've shown in the past that the closer the strain in the vaccine is to the strain affecting the pigs, the better protection you'll get. But how can we continue to leverage the commercial vaccines with these autogenous vaccines? And what's the role of this new vaccine that became available, live attenuated influenza virus vaccine? Well, how can we use all these tools together to the betterment of the pig? And that's what we tried to do in the study, just the preliminary pilot results to see, okay, what combinations can we do and where should we go next?
Now, you made a good argument for the commercial vaccines, but also a very good one for the autogenous products because they are specific to that herd. Why not just use autogenous all the time? Why would you want to use it in combination with a commercial?
That's a good question. The autogenous, not every single virus that you find in your herd is amenable or ready to use. It won't always grow in the system. Then there's sometimes a delay between the autogenous vaccine and the time you can get it into your herd because you have to go through quality and some testing before it's released, and that takes some time as well. And so the commercial vaccine is off the shelf. Ready to go. And so what kind of combination can you bridge the gap even? Okay, I can use the commercial vaccine until my autogenous is ready, and then do I just switch to one or the other? So that's what we tried to do.
Well, and walk us through your study. I know that this was the first one, as you said, probably the first of many. How did you go about choosing the combinations? Was there a strategy behind each one?
Right. So we've been doing influenza surveillance as a country at the United States quite well since about 2010. And a lot of pork producers and swine veterinarians here in the United States monitor their pigs for influenza all the time. And what we've seen in the United States is that we have two strains that really dominate the infections in our pigs. We have an H1N1 virus, one we'll call the gamma virus, that's very common in pigs in the United States, and it's always seen quite a bit, the most common virus we see in pigs. We also see H3N2 viruses in our pigs, and we have a strain that actually came from humans into pigs around 2010, 2011, and that virus has become established in pigs. And we see that type of human like H3N2, or the name number is 2010.1. We see that type of H3N2 in our pigs all the time. But nobody's done studies with those two viruses, to my knowledge, exposing those pigs to those viruses simultaneously, or those most recent strains. So we really wanted to do that, is see what is our commercial vaccine going to do against these two recent strains that are very common in pigs. So that was one of the things we wanted to accomplish. Because those two strains are so common in the United States, a lot of swine veterinarians have helped their clients by making autogenous vaccines with those types of viruses in their autogenous vaccines. So we knew that there were autogenous vaccines out there that had these strains in them. And we collaborated with local practitioners that would let us use their vaccine and say, okay, we'll test it in your experimental model, just to see how the combinations would be. There was several different treatment groups set up. There was the group that received the autogenous first and the autogenous second, just the way you would do on a farm every other day. There was a group that saw the commercial vaccine first and the commercial vaccine second, just as you would do per the label of the vaccine. Then we did the other combinations. We gave the autogenous first and the commercial second, so that's that heterologous, that different prime boost. And then we did the commercial first and the heterologous second, which just the opposite, to see if there's ways, because there is some studies in humans that say pigs, well, the host, humans, can only respond to the first virus they see.
And then sometime using the commercial inactivated vaccine, and then other times a commercial live vaccine.
Then there was a group that we used the live vaccine per label instructions, which is just one dose. And then another group that we did the live vaccine followed by the commercial. And that was another group. And then, of course, we had our negative and our positive controls to make sure everything worked out.
So you have all these different combinations, lots of people looking at them. What were the results?
When we gave the combination of the commercial vaccine and the autogenous vaccine, those pigs had less virus shedding through their nasal secretions and deep in their lungs, in the lung fluid, than pigs that were not vaccinated. and they had less virus shedding than pigs that were vaccinated the way we usually do it, which is give the same vaccine twice. In not all cases was it statistically significant, but there was a trend that these pigs appear to be having less virus shedding when we do the combinations of the vaccines than when we do our traditional way of doing things.
So it sounds like a really interesting study, and I know you had a lot of people looking at the numbers, but what were the takeaway messages?
The takeaway messages were this. We expected the autogenous vaccine to perform really well because it was actually closest to the viruses that we challenged the pigs with. And that's what we've shown in all of our research. The closest the vaccine strain is to the challenge strain, the better the pigs do. So pigs that got 2 doses of the autogenous, they had less virus shedding through their nasal secretions and less virus shedding deep down in their lungs. Interestingly, the commercial vaccine combined with the autogenous, either given first or second, performed similarly to that autogenous combination. So all these, what I'm talking about now, are inactivated vaccines. And so they all performed similarly. They decreased virus shedding through the nasal secretions, and they decreased the virus shedding deep down the lungs at the end of the study. So that was very encouraging to us. And of all those groups, all the vaccinated groups did better than the non-vaccinated pigs. And so that's a good thing to show too. Very small numbers of pigs, and we definitely want to repeat this study. We also found that when we primed the pigs with the live attenuated influenza virus vaccine, and then we boosted the pigs with the commercial killed vaccine, those pigs also had less virus shedding. It's not always statistically significant. We have small numbers. We want to repeat these studies in different conditions, maybe simplify some things to really get it going. But we have what we think are encouraging results. And what we really wanted to do was have new tools for people, because sometimes it takes a long time to get that autogenous vaccine. Well, for pig farmers, a long time is it going to be 1 day or 2 days, right? So it's never fast enough. We always want to take care of our pigs as quickly as we can. And so if we have the ability to use vaccines that are readily available to us and then refine that influenza control approach, we'll do that every time.
I know it's only one study, but then what are your recommendations to swine veterinarians and producers at this point based on what you saw in this trial?
Yeah, I do. I've always been a proponent of vaccination, and the vaccinated herds have less influenza than unvaccinated herds. So I've been a proponent of vaccination because I'd like to decrease the amount of virus being shed by the pigs so that they don't spread it to other pigs. And we always have to remember that influenza is a zoonotic disease. So I don't want pigs to be producing viruses that could affect humans or other species. And so I've been a big proponent of vaccination. But it's not perfect. It doesn't work all the time. It doesn't certainly work the way our pig producers want it to do, which is perfectly every time. And so we have to continue to work with influenza vaccines and management tools to control influenza, the disease as a whole. And we'll continue to do that until we get it right.
Were any of these results surprising to you?
I was very pleased to see that you could take the different combinations and get results that were similar to what you thought would be your best vaccine. So that was encouraging to me. Because a lot of the times we want to do something right away, and the commercial vaccine would be readily available. So until we can get our vaccines perfected, we have ways to use the vaccines we have in ways that should help our pigs.
We've been talking to Marie Culhane. She is an associate professor at the University of Minnesota. Marie, again, thanks for coming by.
Thank you.